Everyone, today we're going to discuss blood flow restriction training. If you don't know what blood flow restriction training is, it is a little bit off the beaten path. It's also known as occlusion training, although I've been told that occlusion training is a inappropriate term because occlusion would be more indicative of like cessation of blood flow, whereas blood flow restriction training, our goal is just to slow it down a little bit. An occlusion cuff or a restriction cuff is placed at a certain point on the arm or leg. And if we think about our anatomy, our arteries are deeper within our tissues, and they send the blood flow out from the heart out to our limbs and extremities. And then the blood becomes more superficial in our venous system as it starts to return to the heart. So with blood flow restriction training, that superficial wrap on maybe the upper arm, as the image is there, what that's going to do is that's going to slow or impede the flow of blood back to the heart. And so those bloods and fluids are going to be not necessarily trapped, but restricted to that limb where the wrap or the strap is. And we're going to get some benefits from that we'll discuss today. So Yoshiaki Sato in Japan actually started doing some research regarding this phenomenon or this potential training stimulus in 1967, I believe. And he was collecting data for about 6 years and looking into it and doing some research. And then in 73, he actually suffered an injury or a couple of injuries. And then using some of the research and things that he had been looking into, he performed some self-experimentation and achieved some outstanding results. And this basically sparked and inspired him to dive in a little bit deeper and to pursue more research and to start a little company and things like that. So blood flow restriction training is sort of born out of his work and is known as Katsu. And so we're sort of, if we're standing on the shoulders of a giant, he's the giant we're standing on. He found that some isometric holds. So if you think about your joints being mitigated, not being able to do squats or leg extensions or jumps or anything like that, but if you can do isometric exercises and not challenge that joint to articulate with the restriction wraps, he was able to stimulate his muscles at a higher level than he wouldn't ordinarily be able to. And this is, Sato started his research back in the late 60s, but this is prevalent right now. So with the Tokyo Games going on right now, there's even American athletes who are pursuing this training method. And again, the blood flow restriction is not necessarily for maximum strength increase, but it can be used to build endurance, boost recovery, help with hypertrophy, and then recovery. In the recovery world, physical therapists now have blood flow restriction training within their scope of practice. And the research and the results that are coming out for post-ACL rehab is pretty impressive. So the data and the anecdotal studies or anecdotal evidence that is being done shows that this is has a high potential for a big impact, especially with injuries. I also understand that with trauma wounds with the military, such as maybe amputations or just limb injuries, I understand that this is also being used to speed up recovery in those cases as well. So a little bit away from our athletic endeavors and more into some of those issues. I understand that there's been some great strides there as well. So a New York Times article reported a couple of American athletes, a swimmer and a runner, using some of the blood flow restriction techniques. And pretty cool. I don't coach swimming. I don't do a whole lot of swimming myself, so I didn't really even think about it. But Michael Andrew, the swimmer, who he competed a few days ago, he now has an Olympic medal. He would actually do some blood flow restriction on his arms and legs and get in the water and swim around. And it says the runner-up has been doing strapping on his legs. I'd be curious what kind of training he's doing there. And I guess we'll see. He's going to compete in about a week, I believe. So maybe I should have waited to do this video another week to see how he does. But a couple of high-level athletes are employing this technique. I think neither one of them is really going to benefit from being extremely strong or extremely large. So really they want to have healthy muscles and have high endurance and things like that. So take that for what it's worth. Let's dive a little bit more into why. So really the goal is to achieve greater gains in strength and hypertrophy while decreasing overall stress on the body. So the blood flow restriction is going to create basically a hostile and maybe toxic environment in the blood that is basically reflects what it might look like to go through a very, very stressful workout. But we're sort of tricking the body because we're going to be handling lighter weights and our joints are going to be, so we're getting less strain on the physical structures of the muscles, and our joints are going to be way happier. So it's kind of a trick or a hack, I guess. And yeah, I've got multiple sources of information today. So we're going to see things like 20 to 50% of our 1RM training duration. And then look at our data there at one of our bottom bullets is at the release of growth hormone. So exercise-induced hormone release, exercise-induced growth hormone release is going to be up to about 170%, which is pretty impressive, but even more impressive when we take into effect that what you're really doing is handling maybe a quarter of your maximal load. And it's also been shown to have decreased. It's actually going to be sort of almost healing and recuperative because of the getting so much blood and fluid into the area around the muscles, and actually showed a decrease in DOMS or soreness over the next couple of days. So it almost sounds too good to be true. Maybe it is. Not too many risks with it, as long as we're training by some of these guidelines and we're being reasonable. So you wouldn't want to create a tourniquet. You wouldn't want to create a tourniquet and do actual occlusion training where the blood flow circulation is cut off. So basically our big or our go-to advice for cuff tightness, if we don't have a machine that's telling us exactly how tight to make it, would be about 70%. So sort of a 7 out of 10 sensation on tightness. More on that soon. All right, so here's some of the stressors that come with high intensity training. So not necessarily near maximal training, but compared to the loads over here, way more significant, 2 to 3 times heavier and more intense. And it's with that heavy training. Now we know that intensity is what is the stimulus that's going to drive adaptation. So we look at all of these benefits here: strength, the muscle damage, lactate production, neuromuscular recruitment, hormone release down here, time to adaptation. So all those good things that come with high intensity training. And then let's compare to low intensity training. It's just not the same. That's why there's such benefits to pushing ourselves and to training heavier, especially when we're pursuing some strength gains and some muscular hypertrophy gains. All right, so if you look down here, it basically says no change from baseline, arguably a waste of time kind of thing. Now, if you do that same training, that same type of intensity, but now you're doing blood flow restriction, you're basically getting all the same benefits. You're basically getting all the same benefits as HIIT training. And then I'm just going to point out here that the muscle damage is not significant over here. So arguably another benefit over HIIT training. Again, so many things are equivalent here. Oh, look, here's another thing that's even better than HIIT training. You're actually going to get, it says you're about 70% greater than HIIT training over here. And it's hormones that sort of really change our bodies. So we can train all we want, but if our hormones are off, we're not really going to change, right? So that's why people pursue additional hormones, right? So there's some athletes that are going to the Olympics right now that are being banned and caught with extra sort of unnatural hormones in their bodies. But with this type of training, you're giving yourself an advantage, and you're doing less damage to your body and your joints while you're doing it. And we get there faster as well. So not only are all of these things basically equal, but look, we get less muscle damage, we get more hormone release, and we get a faster time adaptation. So something to keep in mind is that when you're programming for blood flow restriction training, so let's say you want to do extra arms or extra triceps or things like that, you may not necessarily need to do it for 10 weeks at a time, but maybe little 2-week pockets spread throughout the rest of your training may actually be enough to start to influence the tissues and to cause some changes. Again, exercise-induced growth hormone response. So just want to remind everybody and really hit home that with this type of training, we're causing such a hostile environment of blood in those tissues that our body is really going to send in support by way of hormones to help with healing and growth. So we're going to cause an environment that looks as though we've been going through devastating, hard, high intensity training, but it's easy on the joints, it's easier on the muscles. Lighter weights, your central nervous system is going to be a little bit fresher as well. There's some good high impact potential for using this method. All right, so amongst these hormones that are being released and activated, think about the release of myostatin concentration. So, or not release, but reduction. So, if anyone has ever seen these bluebell cows and bulls, they look like they are just killers. But what they have is they've been bred and they have a low myostatin concentration. So myostatin is going to inhibit muscle growth and muscle gain. And this is just a cow that like probably just like kind of wanders around a field and chews grass. Or I guess it's a bull, but yeah, it's a bovine. It's a bovine. It's not like going to the gym and hitting the weights and things like that. But they're able to produce more, more beef and things like that. So we kind of want to be like those cows and those bulls in reducing our myostatin, and we can produce more beef as well. A little bit on the BFR and the nervous system. As we approach a weight, let's say it's a very heavy deadlift. When we start pulling on that barbell, in the case of a deadlift, when we start pulling on that barbell, it takes us a moment or two to activate all of our muscle fibers. Once we've activated enough muscle fibers, that bar will come up off the ground. Because it takes a little bit of time. Our slow twitch muscle fibers, our lower threshold, they recruit a little bit faster. They have let's see here. They have a smaller, and they have a smaller potential for growth. So you don't really want to, if you're interested in increasing your size, your muscle size, and especially your muscle strength, you don't really want to live on training your slow twitch muscle fibers. You want to get to those fast twitch fibers. With blood flow restriction training, it's going to pre-fatigue the slow twitch fibers and force the fast twitch fibers to handle the load, even at low intensities. So we get to train our fast twitch fibers lifting slowly and with light weights, which normally you have to lift heavy and move faster to get those going. So we get after the muscle fibers that we really want to get after, but we get to do it in an easier way. Central nervous system gets a break, joints get a break, the structures of your muscles get a break. And we know that muscle fibers have the ability to adapt and change a little bit. If all I did was triathlon training, I would create more of a slow twitch environment, and I would see an increase in mitochondria within my muscles and things like that. But with this training, there's a shift towards fast twitch. A lot of our athletes are going to be very interested in that, or people who want to look pretty at the beach or the pool or whatever. So there is some very interesting benefits to this training. And really our key go-to on why we're getting so many benefits is lactate. All right, so as our muscles burn and use energy, a byproduct of that will be lactic acid, which quickly becomes lactate. With high lactate levels, it stimulates our brain to release, it stimulates our pituitary gland to release growth hormone to go in and build that muscle up. It's our body is saying, I need more help. I need to grow bigger and stronger. Our brain responds by saying, have some hormones, let's see how that helps out. So if we look at sort of this diagram here, be thinking about your vascular system, and specifically, they want to point out the capillaries. So over here, no real capillaries kind of kicking in, and then over here we see that that's highlighted a little bit. Again, and kind of compare, one arm to another on this image here. Basically, as it says here, during KAATSU, capillaries lengthen and expand to help improve circulation and vascularity. So what can be called is as like microcirculations is that as our capillaries vasodilate, it lets blood and fluids and nutrients and things like that transfer back and forth faster and easier. See, here's catalyst of vascular endothelial growth factor, this hormone, that hormone, all those good things, specifically nitric oxide, which is going to cause vasodilation. And again, kind of ties into that increased fluid perfusion into tissues. And again, just want to really emphasize and make sure that we all know that as this blood flow restriction cuffs are on, what's going to happen is that blood will still flow in almost normally. The cuffs should not be so tight that blood flow inward is restricted. Well, we're going to slow the flow of blood away from the limb. That superficial cuff is going to be putting pressure onto our venous system, which, yes, may and will back up to your arterial system a little bit. But the goal is that we're preventing metabolic byproducts from being washed out. And so as those metabolic byproducts build up in the local tissues and the local blood supply, it creates the illusion that the body's under enormous stress and that very, very vigorous and traumatic exercise is being performed. And if you look at some more of our data there, again, it's just saying that lactate is going to cause hormone release. And it even says that the growth hormone may be 290 times above baseline. And it says that's even 2 times greater than what is typical of a heavy resistance training session. So just keep in mind that that is the cycle, or that is the process. All right, we are not going to go very deep into any sort of biochem or even too far down the road of old anatomy classes. only to really remind everyone that as glucose gets utilized within the muscles, it then becomes pyruvic acid. With enough oxygen, it then follows that route. With no oxygen, it comes over here and eventually becomes lactic acid. As long as we know that, that's our basic foundation. That's more than enough to really get us through today. So energy gets used, and when it gets used to a greater extent, and there's so much work being done that we can't get oxygen to it, whether that's because we're working really, really hard or because we're tricking the body with this BFR training, then it becomes lactic acid, and lactic acid will quickly become lactate. So that lactic acid doesn't really remain lactic acid very long. That's sort of that's like it's dogma, I guess you could call it. It's just it's what everybody is used to saying, and they continue to say, "Oh, I'm sore. I've got so much lactic acid," or "I got to get moving. I got to get this lactic acid out." Okay, yes, at some point, a hard training session will produce lactic acid, but it doesn't remain there for a long period of time. It quickly becomes lactate, and even that is processed fairly quickly once the activity levels are backed off. So it's true for a short period of time, but people tend to really rely on talking about lactic acid. But you have other things. You have physical trauma going on in the body. You have that healing process where other hormones are being sent in that may cause some swelling, prostaglandins, things like that. So lactic acid, it's relevant and it's real, but it kind of wears the hat of, or I guess it's the umbrella term that so many other things are basically referred to as. So when we create that lactic acid, it's really going to give off the difference between lactic acid and lactate is a hydrogen proton, I guess. And it's going to give off that hydrogen once it's in our blood. And that's going to create sort of an acidic state within the body. And as our body becomes more acidic, think about that limb that's being trained and is in a blood restricted state. As it becomes more acidic, the brain is going to have a bigger hormone response. And the training can be pretty painful because, you think you're not stressing your central nervous system, you're not stressing your joints. What you're really stressing is the blood environment. So basically, a big burn would be appropriate with training. And then we will discuss hypertrophy more so in a discussion on contraction types, but I just want to touch on it here, actually borrowing a slide from the other discussion. Looking at that sarcoplasmic hypertrophy, if that occurs when the volume of fluids in your muscle cells increase, one of the easiest ways to do that is to do blood flow restriction training. If you have those straps on, you're doing training, you will see and feel some of the swelling. You'll see the veins popping out a little bit more, things like that. But what you're really doing is you're trapping that fluid in there. You're going to create a higher hydrostatic pressure that will help drive fluid and blood from inside the capillaries out into the tissues. Yeah, my capillary microcirculation. So again, just thinking about thinking about, that work sort of restricting that blood flow as that pressure goes up within the capillaries, the hydrostatic pressure increases, and you're going to send more blood and fluid out into your tissues, into your interstitial tissues. Okay, how are we going to do it? How are we going to execute some of this training? I would highly recommend getting some of the name brand products, the rehab products and technology that has blood pressure, sort of like a blood pressure cuff. So a thick band that is pressurized specifically for this process. And I've seen that sort of recommended a few different ways as far as specific sort of PSI, or I've seen it recommended to measure the heartbeat in like a fingertip and pressurize the cuff until the heartbeat is impeded, and then you back the pressure off on the cuff by 50%. So I've seen a few different things, and different products are probably going to vary in their recommendations. But if you're not doing it the safe and the scientifically backed way, and you just want to do some meathead things, let's talk about that for a second, because that's a little bit where my own personal experience lies. I'm not recommending it. What I'm recommending is getting the access to the high quality, scientifically backed products that have measurements on them. But for the sake of discussion, let's just dive into some other options. So this lifter here is Dr. Layne Norton, who has been a very successful both powerlifter and bodybuilder, natural athlete, I'm told. And one of the things that he recommends or uses in his training, or at least writes about, is blood flow restriction training. And so kind of on being aware of what he talks about a little bit, I went out and purchased a couple of very simple straps. They're called field tourniquets. And they go on easy. They are not scientifically backed. They are not specifically measurable as to how much pressure you can put on. So there's some big drawbacks there. But they work, and they allow me to play around with the stimulus a little bit and to kind of do something different. And will it end up hurting me or someone else? I'm not sure. I haven't heard any horror stories. But I'm very reasonable. So if they say to tighten it to a 70%, I usually don't even go that tight on it. So I tighten it up enough to create some blood flow restriction, but I'm not getting a very extreme with the tightness. So that's kind of what I use sometimes. And then another item that he's going to use is just like a knee wrap that you would maybe wrap around your knee for a squat session. So again, another option would be the knee wrap, and wrapping that up high on the thigh, close to the groin. And the training that can be done there. I'm not sure that he's on the bike there doing like some pedaling, things like that. But that's not a bad method. I've done that, is to, wrap the legs and then to do a high resistance, slow pedaling, things like that. So no, it's not 20% of my 1 RM of a squat. But what I do is I just I take some of the recommendations and I get something that's light but has resistance, and then I try to create create a burn within the muscles and to feel it out and to just feel those legs. Although I'm not going through some crazy lunge or squat session, I just try to feel those legs getting a high burn within them. So I get all the benefits of a really high intensity workout, but I'm kind of tricking my body because I'm just doing something that's a lot safer on my joints, my nervous system, and my muscles. Again, I might wrap them up and play around with this every once in a while, but I am not cutting off the circulation and trying to make my legs explode or anything like that. So again, I'm not recommending that. I'm recommending maybe experimenting with more of a scientifically backed product. But if we're not going to get our hands on those, these are an interesting option to play around with, just to familiarize yourselves with a unique training method. All right, where can we do this? And go thighs. So again, you can do the rep. Oh, let's get a different color here. That's not gonna work. You can wrap the thighs, upper arms, you could do the calves, do the lower arms. Now, and you never do, from what I'm told, you never do 2 reps at a time on the same limb. So you would never do an upper arm wrap and a lower arm wrap, or a thigh wrap and a calf wrap. You do one or the other. And some of the recommendations here: to 3 to 5 sets of muscular failure with 20 to 50% of your 1 RM, with 30 to 60 second rests in between. So you can do, get set up, get your reps, get your weight on, and do a set. It might be 15 to 30 reps. It might just be until failure, until burn. Short break. Again, what's going to happen is that blood flow is restricted. So it's going to slowly recover and feel better. But what's going to happen? What's going to happen is you're lifting so light. You're lifting so light that you're going to be ready to go again shortly. So you jump back in, you kind of dig into it and pick on those muscles again, and cause more of like a bro pump and just a deep burn. That Dr. Lane Norton, who I just showed, he said that this is some of the most painful training that he's ever done. And he's lifted a lot of heavy weight. So I think that's really saying something. And again, the magic number for tightness is at 70% of like a perceived sensation. And again, if you don't want to do this with thin bands, because that can cause tissue damage. So think about a thicker band. Yeah, okay, so it says to make sure that there is a pulse. Okay, here's some specific cuff pressures. Some specific repetition suggestions. And again, they're different. I've included different resources, so not one perfect little method for us to consider, but I want to bring in some different ideology and some different processes. This is the ACSM recommendations. allow reperfusion every 5 minutes or 3 minutes. Depending on how tight the wraps are. Now, Sato, the fella I mentioned earlier, who sort of created or innovated this process, he mentions on his website that depending on the cuff tightness, you could actually put them on and just kind of sit around. So depending on how injured you are, that might be an option. Not something that I've done before or really have an opinion on, but I would say if you are, the cuffs are on tight and you're getting a big burn, once the work is done, more is not always more. So you basically want to get in there, cause some of that trauma and cause some of that, some of those issues, and then get the cuff off so that fresh blood can come in and bring in some of those good hormones with it. So it says 5 minutes to 3 minutes. Other entities I've seen, there's like a 15-minute time limit. So from what I've seen, from what I've experienced, I would say try to get those cuffs off within 15 minutes. Yeah. And again, this is a great rehab modality. The science behind the speed, the increased speed at which people are rehabbing, to say that it's mind-blowing is not an exaggeration. It's pretty awesome. The research says that it's going to speed things up big time. And we saw this slide already today, but I just wanted to bring it, and this is our last slide for the day, but I just want to bring it back in because it basically highlights how unique and awesome this is that we're going to get all of the benefits and more that we would get with high intensity training, but we get to do that with safer low intensity training. And again, I would encourage, if anyone's going to do this, I would encourage you to do it in more of a safe setting with measurable blood pressure cuffs and things like that. Maybe I wouldn't do this the first time you do this. I would not do this on my own in your basement or something like that. So the first time I ever experimented with this, I got a little lightheaded and I had a headache that lasted like 3 days. So I don't know what that's about. But I'd say it's a little bit different type of training. So that might have been just a 1 in a million random thing for me. But I rarely get lightheaded or headaches. So the fact that I got both those things the first time has kind of stuck with me. But if you're going to play around with this or experiment with it, just remember there are great benefits, great possibilities. I would do this maybe a few times a week at the very end of a lift, or if you have a day where you're not doing a lift, like a true lift, and you just want to do like 15 minutes of work, or if you do upper and lower body days, maybe on a lower body day, you do your big lift in the morning, and then in the evening, you could do 10 to 15 minutes of arms or something like that with this VFR approach. So that is blood flow restriction training. And good luck, everybody. Stay safe.